I'm a student PT. Do you mind if I palpate different structures on you?
Sure.
Okay, so go ahead and lay on your stomach. Okay, so the first thing we're feeling for is the PSIS. Oh, thank you.
Mm-hmm.
And first you feel for the iliac crest, and you just work along the border of that. And you can find 2 bony protuberances on either side of the spine. This serves as an attachment for the posterior sacroiliac ligament, and it also can help you find different structures of the low back. The next thing I'll find is the inferior lateral angle of the sacrum. So you can start at the PSIS and work your way down. And you can start feeling the lateral borders of the sacrum. And that'll be it right there. And there are some ligament attachments here, and this will also help you find the coccyx bone. Okay. The next would be L5, so again, we'll start at the PSIS, and you can work your way medially, and that would be around where S2 is, and you work your way up. And the first bony protuberance that you find would be L5, because the sacrum feels relatively smooth. This is a common site for low back pain, and you can also feel for the space between the lumbar and the sacrum. Let's see, the next thing would be the ischial tuberosity. So that would be where the hamstrings attach. Is it okay if I pull your shorts in? Okay. So you'll just start at the gluteal fold with your palm, and you feel in a superior motion. You can feel the ischial tuberosity. There's also a bursa here where the hamstrings attach, which could be a common site of injury. The next thing would be the 12th rib, which we can find from here. So I usually find it with the iliac crest, and then I just work my way up the side, and there it is right there. So the 12th rib can be used to find structures such as T12, or you can work your way up the ribs to find the 11th rib and onward. Let's see. Can you go ahead and lay on your back, please? So we'll start at the hip and the pelvis. So the first thing we're going to feel for is the ASIS. So again, starting at the iliac crest, you just work your way anteriorly. And the first bony protuberance is right here is where it would be. This is where the sartorius attaches, and you can also use this as a landmark for other structures near the pubis. The next thing would be the medial femoral triangle. So what we can do is we can find the ASIS, and that's where the sartorius attaches, and that would be one of the borders. And then what I'm going to have you do is cross this leg over, and then resist against my hand. Push, push. So here is adductor longus, and then you can feel sartorius right here. So this is where the medial femoral triangle would be. Go ahead, relax. And this is a common site to find the femoral artery, so you can find the pulse there if you need to, and the femoral nerve is also in this area. Let's see. Next thing would be the greater trochanter. So that one's an easy one. I usually start at the side right here and feel with my palms in a circular motion, and you can feel it right here, little protuberance, and that would be the attachment sites for a lot of the posterior hip muscles, and you can use this also as a landmark for other muscles. The next thing would be the liver. So it's located in the upper right quadrant of the abdomen. So usually what I do is I usually feel for the bottom of the ribs, and then I just push my hand down just a little bit, working my way around until I feel kind of a firm end feel, but it's smooth and not as hard as a bone. And there's not much detail to it, but it's one of the few organs internal organs that we can feel, and if there is something that doesn't feel right in the liver because it's not smooth, we can refer someone to a doctor. Let's see. Go ahead and sit up for me and face the wall. Okay, so we'll do some of the cervical spine. So we'll find C2. So first I usually start at the occipital protuberance and work my way down until you find the first vertebrae that you can feel, and that's the spinous process right there. And from there you can work your way down to count other cervical vertebrae, or you can work your way down to find other cervical vertebrae and count down from that, or you can go laterally and find the articular pillars. And speaking of those, we'll move on. So I'll go back to finding C2 and I'll just work laterally so I can feel where the paraspinal muscles are, and then if I work my way out, I can feel the facet joints. Okay, and then let's see. So that next would be C6 and C7. So I would look for the most prominent of the spinous processes in the neck, and that I can probably assume is C7 because if I go up one, go ahead and extend. So it'll disappear and then come back up. So that's C6, and the one that stays is C7. So again, you can work your way down and find more spinous processes and count your way down from that. Or you can, that could be a common site for neck pain, so you can fix that if you need to. The next thing would be the first rib. So you can start at the neck and work your way down and a little bit anterior, and if you push down, there's a firm end feel. That would be the first rib, so that makes up the base of the neck, and there's some muscle attachments there also. All right, go ahead and sit and face me. Okay, so we'll start at the knee. So the first thing we're going to feel for is the knee joint line. So you can find the lateral and epicondyles of the femur and work your way down to the space. And I can feel it right here on either side. And you can use this to find the medial and lateral collateral ligaments. The next thing will be the fibular head. Do you want me to do this side?
Oh, no, it's fine.
I'll just work it this way. All right, so for the fibular head, I'm just going to move it up just a little bit. So I can use the palm of my hand in a circular fashion, and it'll be right there. And it is a common attachment site for the biceps femoris and the lateral collateral ligament. Okay, so now we'll move down to the foot. So the first thing we'll find is the talus. So I usually try and find the joint space between, or the talocrural joint, and I can find the talus is right there. That's the upper dome right there. And from here, I can come out and find the lateral and medial ligaments of the ankle, or I can work my way up and find the anterior talofibular ligament, which is the next one. And so finding this structure, like I said, you work your way up the talus, and it's a common site for an ankle sprain. So that's a good ligament to know. Navicular tuberosity, so using the palm of my hand, I can work my way around the foot, kind of below the ankle, and working distally, and I can feel that protuberance right there, and that's an attachment site for the posterior tibialis and the spring ligament. Next is the base of the fifth metatarsal, so instead of medially, we're going to go laterally. So I usually start at the fifth toe, or the fifth digit, and I'll work my way down until I find this protuberance right here. And this is important because both of the fibularis muscles, longus and brevis, attach here. So if there's any issue with those muscles, this could be a site of pain. so now we're going to go up to the shoulder and elbow. So the first thing we're going to do is we're going to look at the AC joint. So I'm just going to pull this a little bit. So we're going to start at the clavicle, work our way out, and where this protuberance is right here, that's the AC joint. It's a common place for injury with the clavicle, and it's also a good site to work your way down to find landmarks of the humerus. The next is the spine of the scapula, so I can start at the AC joint, work my way back. Oh, yeah, you can turn. There you go. Thank you. So you can work your way back past the acromion process, and then the scapular spine would be right here. So this is a good attachment site for the supraspinatus and infraspinatus, and if you go medially, that's where the rhomboid's attached to. Oops, sorry. It's the inferior angle of the scapula. So in order to find the inferior angle of the scapula, go ahead and put your arm back for me. So I'll just find the medial border and work my way down, and it'll be right there. And this is a good site to find some of the rotator cuff muscles, such as teres major and minor. Okay. The next thing would be the subacromial space. So we'll start at the AC joint right here, and we'll just go laterally to this space right here, and if she abducts, go ahead and do that. That space disappears. So this is a common site to find a few different rotator cuff ligaments. So if you move in a circular fashion, you can kind of feel each one. Okay. Next is the greater tuberosity, so that's on the humerus. So using the palm of my hand, I'm going to be inferior of the AC joint and a little bit anterior, and I will feel it right there. And so one of the biceps tendons attaches to here, and again, this is another way to find some landmarks such as the lesser tuberosity if you just keep going back. Okay. Next is the coracoid process. So if you go from the greater tuberosity anterior, you'll find this bony landmark right here under the clavicle. And this is a site where the pectoralis minor attaches and also part of the biceps tendon. Okay. Lateral epicondyle. So I'm going to look at the condyles of the epicondyles of the elbow. So the medial one is very easy to find using the palm of the hand right there. And this is a common attachment site for the wrist flexors, and you can also find the olecranon process posterior to it. And then for the lateral epicondyle, same thing, palm of the hand. It's a little bit harder to find, but it's right there. And this is a common attachment for the wrist extensors, and you can also find the olecranon process posterior to that as well. The next is the radial head. So again, if we start at the lateral epicondyle and work our way down, and you can also take your two fingers on either side and feel for it. Let's see if I can find it. About right there. And you can move it back and forth a little bit. This is a common site for dislocation, so that's important, and also feeling for pronation and supination of the arm. Okay, I do the scaphoid bone, so I'll just have you turn it like that. So go ahead and extend. There you go. So if she extends her thumb, you run into the anatomical snuff box right here, and the scaphoid bone is right there. So that's a common place for a wrist fracture, or you can find the radial pulse there. And the last thing is the triquetral bone. So that will be found on the ulnar side of the wrist. So you can start at the ulnar styloid process and work your way superiorly. And it should be right here. And you can feel when the person ulnar deviation. it'll disappear, but with radial deviation, it'll stick out more. And you can use this bone, you can put your hand down, you can use this bone to find the tunnel of Guion or the pisiform bone. And I think